Hi, everyone. In the week one assignments, one of the questions I asked is when you become a therapist in the future, what's a behavior that you think a client could be doing that would affect your ability to be a good massage therapist? And I had a student answer loud gum chewing. And I personally have a problem with wet mucus sounds, sucking that snot up and swallowing it. Ugh, gives me the heebie jeebies in the office. And they said that it could be distracting and make it hard for them to stay focused and provide a relaxing experience. Absolutely, that constant sound. However, we need to talk about bubblegum in the massage office. You need to make them spit it out. It's a huge choke hazard when they're supine and side lying. It can fall in their hair, and I have seen it stuck on the floor, under the tables, and worse, tucked up underneath the table so it's all over my hand when I'm trying to change the sheets. So it seems simple, it's a choke hazard, but let's talk about a couple of reasons why we shouldn't be chewing gum or hard candy or have anything else in our mouths in the massage office, either as a client or as a therapist. So, first of all, obviously it's a choking hazard. So, this is the most serious risk, whether you're lying face down, prone, or on your back, supine. Chewing gum means that your client might accidentally inhale or swallow it, especially if they're startled, they cough, they drift off to sleep, or they take like a deep breath all of a sudden. That gum can become lodged in the windpipe, which requires immediate emergency intervention. This is why I wholeheartedly, you'll probably hear me say this a couple of times when we bring up safety. I love the D choker device. I have nothing to do with them. I would love to sponsor them if they ever got interested one day, and sell their products, but they are amazing. I think they're the most heavy duty anti-choking device on the market that I'm aware of. It comes with like this sealing respirator mask. The tongue depressor presses your tongue down, but also inserts the tube further back towards your windpipe. And it's got a pretty powerful plunger to suck that air out and to suck out whatever has lodged in there. This is super, super helpful when you have clients that might be larger or heavier. Maybe you don't have the arm length to reach around the circumference to really get underneath there. If your client is geriatric, doing the Heimlich maneuver can be kind of painful, disruptive to them physically in many ways. And D-choker comes in both pediatric, like smaller child sizes, as well as adult sizes. So throwing that out there, I keep one at my home, in my office, and in the car, especially if my kids are having a snack and we're driving just for a sense of safety. So, what else is going on? If they're chewing a peppermint, they're chomping on that gum, you may have excess jaw strain or TMJD aggravation in your clientele. So, massage obviously aims to relax the muscles, including those in the jaw, and that constant repetitive motion of chewing works directly against that goal. It can keep the masseter, which is the primary chomper muscle that we have, the temporalis, all of those muscles engaged and tense, leading to soreness or aggravating pre-existing TMJD if they have that. Also, for you to properly assess and address tension in the neck, jaw, and hyoid muscles, the client's jaw needs to be relaxed and passive. A chewing motion makes an accurate assessment and effective treatment of this area pretty much impossible. Another thing to keep in mind is digestive issues. So, the act of chewing signals to the stomach to produce digestive acids in preparation for that food it needs to break down. But with no actual food arriving, this can lead to acid reflux or heartburn, especially when you're laying down flat on your back supine or on the right side. When you're laying on your left side, the gastric acid can settle down in the lower level of the stomach below the level of the esophagus. When you're laying on your right side, that acid can seep up into the esophagus and cause a lot of reflux issues. You can also get a lot of air in the stomach this way, and then your client can be burping, which can accidentally lead to a little accidental vomiting in the massage office as well. And of course, constantly chewing on something, a straw, a toothpick. A toothpick would be dangerous, but this gum can prevent deep relaxation, right? That rest and digest. We are trying to turn on that parasympathetic nervous system. That's the primary goal of massage, to relax. And that rhythmic, often subconscious motion of chewing, chewing, chewing keeps the nervous system just a little bit active, preventing the client from achieving the deepest levels of relaxation. So we're not going to slip into a fully altered state. There's also disrupted breathing patterns. Proper diaphragmatic breathing is crucial for releasing tension, also losing weight. A lot of that comes out in CO2. But chewing gum can disrupt a client's natural and mindful breathing rhythm, which makes it a lot harder for the therapist to work with the body's respiratory cycle to release deeper layers of tension. We talk a lot about diaphragmatic breathing and massage modalities that relate to that when we talk about respiratory disorders and massage therapy, as well as breathing techniques to relax your clients. Another thing is an audible distraction. That repetitive popping, smacking, or cracking sounds can be really distracting, and that breaks that serene, quiet atmosphere, especially if you want that spa-like quality, if it's a less clinical and more serene environment. And that's going to disrupt it not only for the client, but for you as a massage therapist, potentially, again, altering your ability to perform. The other big question is what to do with it. What do you do with the gum once it's in your mouth and you're on the table? Of course, if you're a responsible therapist, you have your plastic lined trash can, because we all know wet things can happen, hacking, coughing, nose blowing, and in this case, gum spitting. Get it out. But the client might be faced with, what do I do with it when I need to turn over? Or if you need to work on their jaw or face and they don't want to tell you about it. Disposing of it mid-session is disruptive, even if they spit it in a trash can, but sticking it somewhere else is super unhygienic. There is nothing like changing your sheets after a client and discovering a wet, sticky pile of a chewed gum glob stuck underneath your table, and then your fingers get in it when you're changing your sheets. Or better yet, stepping on it and grinding it into the floor underneath the face cradle because they've simply let it drop while they are face down, prone. So the best practice to avoid this situation is a polite request every time you see a client, and include it on your intake forms. Any type of pre-massage instructions. Say, hey, for your safety and comfort, please refrain from chewing gum or any other objects during your massage session. If a client feels that they need gum for fresh breath, you could absolutely offer them a breath mint that can be chewed or dissolved before the session begins. Or you can even keep mouthwash with disposable cups or small disposable containers for your client to utilize and rinse their mouth out before that massage begins, if that is a hygiene concern. All right. I look forward to talking to you guys about the other assignment shortly. Have a great day.